Y'all ready for the last session? Maternal mortality in the USA. It is time to tell the truth. There's a powerful story that needs to be told about the resilience and strength of mothers regarding maternal health and the mortality rates associated with pregnancy. Today, we have Jeannie Joseph, a British-trained midwife, joining us for this discussion, Maternity in the USA. Thank you.
Thank you, Dr. Boynton. We are so happy to have you with us. All right, can everyone hear me? All right, thank you all for hanging. So we're going to discuss a topic which we know is on everyone's mind, which is why Black women are dying during childbirth. And I had the pleasure of meeting Jeannie when we both became honorary members of Zeta Phi Beta Sorority Incorporated. Yes. And what was fascinating is that Jeannie and I were on a panel, and I was advocating kind of this standard line, right? Black women need to be more proactive. We need to question more. All that is good, but Jeannie was like, wait a minute. When we're going into this situation,
yes,
into childbirth, there is nothing really wrong with us. Go ahead.
Exactly. No, thank you for that. You know, it's a shame because we've listened and we've heard that messaging. And at this point, we're like, okay, I got to do this, I got to do that, I got to do the other. We don't have to save our own lives. Are you kidding? This country has created a situation where it is unsafe to be pregnant, to be having a baby, or even to be postpartum. The most developed, most resource country in the entire world. How shameful that we are dead last when it comes to developed countries as far as maternal health, maternal mortality, and infant and health and mortality. Black women, Black babies are dying. It's unnecessary. Pregnancy is a normal life event. Yes, some people have complications, but the majority of people will continue, as we have for millennia, to be able to bear children and continue this human race. When I was on the panel with Rosalind, I was, as usual, and like you say, this is not an unusual message. Eat better, lose weight, drink your water, do all the things. Yes, of course. But the reason that we are dying or being harmed is not because we didn't do that. It's time to tell the truth. The system is killing our mothers. The system is killing our families, our loved ones, our colleagues, our neighbors. We have delivered Americans for millennia, centuries. The enslaved African midwives delivered this country. It was Black women who delivered and maintained the commodity that was human chattel. It was Black women after slavery who continued to deliver across the United States, particularly in the southern United States. I don't know how many people know, but at one point there were 9,000 midwives in Georgia. And yet Georgia is currently tied with Louisiana for being dead last as far as maternal mortality in this country. It's that is the problem. This is where we have to consider, and I'm at this point ready to declare a state of emergency. This cannot stand.
So what you're saying is that if this were 1955 and I was getting ready to have a baby and I might have had maybe 1 or 2 comorbidities, I would have a better chance of surviving childbirth then than I would have now?
Absolutely. Yes. And the reason I hear the yes is exactly, we already know, right? Why? Because whoever took care of you, whether you had comorbidities or not, whether you had additional issues that might have made you more at risk, whoever took care of you, the very fact that they cared about you would save your life. It's so much misinformation right now, but what happens is we are not being heard, we are not being listened to. So when we say something's wrong, there's a problem here, No, please don't send me home. I'm scared. We are not being heard. The grand midwives, we don't call them granny midwives, although that was what they were named, the black midwives who delivered everybody at home. Everybody had a home birth at some point, right? It wasn't until mid-20th century when hospitals started and money was changing hands and physicians said, oh, we could do this instead. It wasn't until that time that people came out of having home birth and began having hospital births. We are now completely the opposite as we used to be. Majority of people, 90+% are delivering babies in a hospital. There's nothing wrong with that if the people in the hospital that are attending you care about you, treat you as a human being, understand and respect you because that's why they're there, right? So when you say that example was so perfect because even inside of all of those constraints, many people, obviously, for much of the time that midwives were delivering, especially in the South, people were poor. They didn't have resources. They didn't have enough to eat. They didn't have the things that anybody would need to survive and thrive. But they were making it work because they made the effort to make it work. We were not allowed in the hospitals when they were built. If we were, it was through the basement. It was through the back door. And we were relegated to have second-class care. The physicians did not want to attend black women, but the midwives were also shut out. This was the beginning of what we have now. But we could go further back. In slavery times, black women were used to experiment on, to understand gynecological needs, and to develop gynecological techniques. And that only happened because we were considered to not feel pain. We were experimented on without anesthesia. We were harmed in so many untold ways, and these traumas continue throughout, passing from generation to generation. We never get the chance to heal. So one of the things that we can do right now is to be aware that what's happening is not by accident, and also what's happening is kept silent. So I want you to take a minute and think right now, how many of you know or even have experienced yourself what I'm talking about? Typically, look at the hands. Typically, as you start to think it through, is that even, actually my workmate, my neighbor, my church sister, somebody, many of us have a story, and it relates to, I nearly died. My baby went to the NICU, the neonatal intensive care unit. My doctor didn't listen. I had such debilitating postpartum depression, I've never recovered. We have these stories. It's time to share these stories. It's time to bring them out. It's time to begin the healing. Because what's going on is happening in plain sight, but we're not able and we're not empowered to speak. We may not be able to solve it. This is going to take a couple generations, took that many generations to change us to this point, but we must begin.
How does one engage with a midwife?
Well, there's few of us, that's the saddest part, isn't it? You can tell I'm not from here, right? I was born and raised in England, and I was a midwife. I started at age 19. I've been a midwife for 42 years, but I spent the first 10 years of my midwifery in Europe, in England, where everybody's a midwife. So just like here, you have registered nurses. Every other person is a registered nurse. In Europe and much of the rest of the world, every other person is a midwife. It's not a fancy thing to do. It's not a fringe or out there, kind of strange thing. It's normal. And again, because we really have to remember our history, it was normal for us too. But nowadays, you have to go searching for a midwife. And state by state, it varies which state you're in, whether midwives are able to practice or not. There are midwives that are practicing and doing home birth. There are midwives like myself, who I have a birthing center in Orlando, Florida, and we deliver babies in the birthing center, a community clinic where mothers can come, have their baby, and go home the same day or the next day. And then there are midwives who deliver in hospital. but you have to go search for them. And when you do find them, some of them have some, independence and autonomy and can really take care of you the way they want to as a midwife, and then others are stuck with, the system says. And you can't exactly then find yourself, able to do some of the things you might want to do. So what are the things people might want to do with a midwife? Well, have their wishes listened to. Let's start right there. We all know our body. We all know what's best for us. We all know what we want. Midwives will center the mother, center the family, listen to what people are saying about themselves and their bodies, and work within that. So it's worth looking for a midwife, but do know that as you go out looking for a midwife, you're not always going to find them very readily.
What's a danger sign? If you're looking for a midwife and you're interviewing several, what's the one that you don't want to select?
Well, you want to make sure a midwife is always working as a collaborative partner so that when and if a complication does show up, that they're able to hand you over to the next level of care, the safe level of care. I think a midwife that doesn't have that support then has more chance that if there is a problem, they really aren't able to handle it.
What about credentialing?
Right. Midwives have a scope of practice. So midwives like myself, for example, I work out of hospital. So my credential is that I'm trained in being able to be in a community setting, home or birth center. My training is a 3-year training and leads to a license as a midwife. That's one type of credential. The nurse midwife has a different credential. They're already a nurse, and then they do additional training to become a midwife. And nurse midwives may more likely operate in a hospital system and be able to attend you into a hospital, regular labor and delivery floor. So it depends on the state, it depends on the credentialing, depends even on the experience. And it depends on whether there's cooperation to collaborate with that midwife. Especially when you're looking at midwives of color and midwives who are able to support diverse cultures. Is the cooperation there? Because if the cooperation is not, now that midwife is unsafe, not for anything she is doing, but from, again, a system that is set up to work against us. So when I say one of the things you can do immediately is check with your family, check into your community and see if you can find out how are things going. When you ask those questions, you're asking, how are you in terms of right now, whether you're having this baby soon or you've had a baby? How are you? Just asking that question and think about it. If you're not asking, no one else is. And when they tell you how they are, listen. Because once again, no one else is. Being heard empowers us all. That's when the healing begins. But that's also when we start getting data and information to know, you know what? This person is the third person who's told me that XYZ provider or XYZ hospital had this happen to them. We need to start being savvy consumers. Where is the safest place? Who is the safest midwife? Which doctor has some compassion? Who cares? We share that amongst ourselves and start making decisions based on what we're learning, things will change.
When I talk about it, and even when we were promoting this session today in social media, we had some comments on Facebook, such as they feel like it's us against them. Mm-hmm. Why are you advocating midwives when there are perfectly good hospital systems? Why is it polarizing?
Yes.
Why are we not looking at it more holistically?
Because we are in America. I think that's the quickest answer to that one. Right? Am I right? It's a territorial, it's a racial, it's a power. The reason we're dying, let's just call it what it is racism, classism, sexism. It's not to do with our bodies. There's nothing wrong with our bodies. We're not broken. Like if all the hospitals were washed away tomorrow, hurricanes came through every city that had a hospital that was delivering babies and they're all gone, what do you suppose would happen? We'd keep on having babies and they'd keep coming out and we'd be all right. at the end of the day. So the territorialism shows up because we have this way of being in this country. How is it that people will not buy into the idea that midwives can collaborate and integrate with the system that exists already? We've got an interdependence when it comes to safety, and midwives that want to work together with collaborating OBs. I work with maternal fetal medicine specialists. I make sure my patients get that pathway. I help them navigate, because I realize it's only so far I can go in my scope. Midwives take care of normal. The minute you're not normal, you don't need midwife care, you need OB care. But we all have to get along. Why? Because lives are at stake, that's why.
Understood.
We have to get all over ourselves. I'm like, get it together here. People are dying. People are being harmed. And again, that's why I'm asking you all, please, start asking those questions. Many folk who hear me speak, well, I'm not having any more babies, so this doesn't apply to me. Do you not have loved ones, family who are going to be having babies? Are we not hanging on now, hoping for our legacy to pass down, for some empowerment to pass through, so that we can say the next generation has it better than us? Just like the point Rosalind made, you might have more problems nowadays than you would have had in 1950s.
In terms of the family unit, do parents and families are they polarized about whether the
Oh, absolutely.
should use a midwife?
Yes.
And how involved is auntie and grandma? How involved should they be in selecting a midwife?
Well, that's a really great question, because in one sense they are very involved, and they're also very scared, and they will probably, I'm just going to paraphrase because I don't know, everybody thinks the same way, but typically, well, we don't do that anymore. We've moved on from that. We fought to be in the hospital. What do you mean you're not going in? That's one of those dichotomies, because again, we've over these last few decades bought into there's something wrong with us and we need saving from. And that the answer is at the hospital. But let's ask ourselves, if that was the case, where did these statistics come from? 3 to 4 times as many Black women are dying. I'm saying it again because I want to make sure we're clear. 1 in 3 women in this country are being cut, having a cesarean section to deliver a baby. Do Americans have some kind of teeny tiny pelvis that doesn't work? I mean, what's going on here? You cross a body of water and suddenly the baby doesn't fit? That it has to be forced out of you at 39 weeks because, like, come on. So when the family members, the mom, the grandma, the auntie, they are coming from a genuine place of fear because of feeling and hearing that what they went through, was only prevented from having been put in the system. The actual truth is, if we go back a couple further generations, we had people in dire straits, impoverished, without the nutrition they needed, without the time or effort to be able to put into exercising and doing all those things, they prevailed.
Fascinating. When looking at your website, I saw that you take patients that would be considered high risk.
Yes. Let me explain that. Why are these patients high risk? Well, many of them are coming into our clinic in the 3rd trimester, meaning they're already 28, 30, 32 weeks pregnant, and they have not had any prenatal care. Why haven't they had prenatal care? Because you can't find it. Because your certain Medicaid card, or your lack of insurance, or lack of money, or whatever excuse people give, you've been turned away. I have many of my patients that have been looking for months trying to find a physician. So let's look at this. You know you're pregnant, everybody, as soon as that test turns positive, knees go to jello, you start panicking, you're like, I gotta find a doctor. So you start calling. What do they tell you? Oh, you're too soon. Oh, we can't take you till you're at least 12 weeks. What if you miscarry? Right? This whole negativity shows up as you call around trying to find a provider. Call us back if you make it past 12 weeks. So you call back after 12 weeks, 14 weeks, and they say, oh, you're too late. I don't have an appointment for a month. Oh, no, we're not taking anybody at this late stage of pregnancy. So now you've got this no man's land. You don't belong. You can't get a provider. Your pregnancy is advanced, and you still haven't started prenatal care. So you run to the ER. Oh, the taxpayers' money. You're wasting why don't you have a doctor? Go get a doctor. Can't get a doctor. There's a catch-22 going on here. So you go a few more weeks and you're still panicking because you still haven't had care, you haven't even had your lab work done, you haven't had an ultrasound. And then you show up again at the ER and someone else has another tantrum. You were here before. You are not getting, oh my gosh, you don't care about your baby. The stress alone is enough for that baby to come out right there and then. 28 weeks, here it comes. Water breaks, panic because of the stress, the assault on your body. So by the time many people find me, yes, they're already in a high-risk category. And then my unfortunate position is I have to then move them onto the OB, the very same OB that didn't want to take them in the first place. And now they're mad because you're coming late. Where have you been? This is a catch-22. These are the systemic issues. These are the reasons that people are suffering. Not because they're bad and wrong, or they don't care, or they don't eat right, or they're too fat, or they're too late. The system has people in a cycle. And then when they do get in, if they do get in, they are considered to be problematic non-compliant. You all know what that means. If that gets written in your chart, it's over. Because that chart will follow you. Right? And the physicians and providers will be like, oh, this is one of those. And now we're going to be scared of them because they may cause a problem and there may be a lawsuit. Compliance. When that's written down, so I don't want this to sound horribly dramatic. This is my experience. To answer your question, that's why. Because unless people get into a provider, they can't get a high-risk appointment. You can't just rock up to the high-risk doctor and say, here I am, I've got diabetes. Like, who's your OB? I don't have one, we'll go away. Because I have to have a chart ready, labs drawn, ultrasound prepared. I have to do all of that first before I can move you to the next phase or refer you to the hospital. If you go into any of those providers without a record or a chart, they are going to turn you away because they don't want the liability. That's why I'm doing high-risk care, and it's a pass-through. We've created a triage in our community for every pregnant person, regardless of their situation, to come to us as the first stop, and then we work together to troubleshoot with them and for them their next best step for their best outcome. That's why our statistics are the way they are. In the 25 years that I've operated in the United States, we have never lost a mother or a baby. We have very few premature babies. Thank you. In the COVID year, we had to go to telehealth, Rosalind. It was all anybody could do. Everybody was shut down. We did a telehealth practice. 450 patients went through that year. One premature baby.
That's fantastic.
And that was telehealth. So that proves to us you can get these outcomes if you care enough to get them. So remember, ask. That's the first one, ABCs. Ask. Any question that's relevant, just ask. Listen to the answer. B, birth. Where are you birthing, or where did you birth? Share the experience and let us know, is that okay, and can we tell other people to go there? C, care. Ask them, is your healthcare provider, do they care about you? If they can't answer that question, then you might not want to be there. A, B, C. We got to get into action right now.
That's fantastic. All right. I tell you, Jeannie, you're doing your thing. Isn't she a spitball? You want her for your midwife, don't you? All right, we're going to open up the floor to questions. Do we have a question over here?
Right in front.
It was actually two questions. One question here, she asked the difference between a midwife and a doula. And then my question is, how, as a newly trained doula, how do I put myself out there more to get the knowledge out that it's okay to get a doula and to inform others of what a doula is and how we help mom more than just baby? Because they think, oh, doula, she must be another midwife. It's like, no. We're not licensed, medically licensed, but we're more so advocates for mom and help mom speak more to advocate for herself in the hospital or wherever she's giving birth.
Thank you, and congratulations on being a doula. Thank you very much. A midwife, as I said, delivers and works with normal, healthy pregnant women, but provides the medical care for those pregnant women. checking the belly, doing the blood pressures, checking urine, measuring, and then also during labor, helping the actual delivery, and postpartum, making sure mother's comfortable, safe, breastfeeding, and so on. A doula does the support piece. So you could consider a doula a coach, for example, right? Just like, some partners will do the coaching, some can't. Whoever is in that family unit, all of them need the doula. The doula is there to educate. The doula is there to stand in the gap. The doula provides emotional support and advocacy in a way that literally fills that C out of my ABCs. She cares. The doula is going to stand with you all the way through. There's a continuity of care with the doula. You meet them in the pregnancy. They're going to work with you through pregnancy, at the delivery, and postpartum out the other end, mother and baby combined. So there is a difference, but there's an important difference. And it's easier to find doulas. There are more doulas than there are midwives right now. More and more people are coming into the profession. And if you think about historically, even though there was not a name doula, every woman in history was attended by other women. That's it. It's your village. The doula provides the support for every person in the childbearing unit and continues that support, an unimpeded connection that is not going to be disrupted by anybody, and doulas will fight, right? If the hospital says you can't come in, oh, you better be ready. Here, she's going to fight, right? So that's who you want in your corner to support you through the pregnancy.
Okay, stand up. Awesome.
Jenny Joseph, we love you and the work that you do.
Thank you.
I am a certified lactation counselor, and I work with boys, men, and fathers, and we deal mostly with preconception health with men, because many times we're absent and not prepared.
That's right.
So the question that I have is, once I found out that our mothers and babies die at higher rates than other communities in these United States, I decided that I would get involved in the fight to save our mothers and babies. The question that I have for you, though, as a certified lactation counselor, I don't have much contact with, those in the hospital space or even women, but my focus is men. I want to teach men about the benefits of breastfeeding and how to advocate, protect, promote, and make sure that their birthing person is cared for during that period, during the perinatal period. How can you use a male certified lactation counselor in your business?
Just the exact same way you described. And what an amazing set of words that you used there in your question. All of those words speak volumes. This is literally what we need. Yes, in the sense of needing to bring the father, the partner into the play, we are able then to empower them to literally save lives. Breast milk, human milk, will save lives. And now that we realize the fact that we have been thwarted from breastfeeding our babies from all kinds of different reasons that have happened, including assuming that everybody's on WIC and they're going to need formula, we now have an opportunity to bring the male partners and other partners into the actual ability to do something. So lactation support doesn't mean that you necessarily are doing the actual lactation, hands-on support, but rather you are sharing with partners why they need to support their partner in breastfeeding. Getting back to work, why they need to help share with night feedings and, preparing the bottles and getting baby ready to go to the nursery or wherever. Why they have to advocate with their partner to have a lactation room at work. Why maternity leave needs to be reimbursed. All of these areas aren't going to show up. There's no other opportunity for education other than through lactation, other than through doula, other than through midwifery. Nothing else is going on. So it is imperative, and I'm thrilled, and you're one of more and more brothers across this country who are involved in perinatal education. We have male doulas. We have male midwives. I'm graduating a male midwife in 2 weeks out of my first class of midwifery students from my school. This is the new way of bringing what I call perinatal power back to our communities. Thank you so much for what you're doing.
Hi.
She's waving over there.
My
question was, does insurance pay for this?
Yes.
So I was wondering why so many people really don't know. I think you kind of explained it because we're so used to being back in the hospital setting.
Yes.
Because I have a girlfriend that's a doula, a doula. I thought that it was more of a private practice, like you gotta pay
Yes.
for it out of pocket. So I don't think a lot of people know about it.
Well, you know, and again, it depends on which state you're in and what's the current situation. In Florida, I'm in Florida, both midwives and doulas are covered by Medicaid. Now, it's a whole big set of hoops to get your money. You can send your claim and wait for, you know, the child's in kindergarten and you're still arguing, right? But there is at least a statute that says you can get reimbursed. So state by state, it does vary. Most people will listen out because you'll hear a lot more news about doulas and you'll know that some of the legislation is coming up where they are being featured and, you know, there's discussions at least. But you're right now, majority are having to pay out of pocket, but there are certain agencies and programs that provide free doulas to communities that are low income or uninsured. So we're on our way, and these are the kinds of fights we have to do. This is organizing work, really, right? You think it's healthcare? It's not really healthcare. We got to do some justice work here. This is birth justice, maternal justice, reproductive justice, economic justice, human rights at the end of the day. So we fight on all these levels.
Okay, go ahead. Ask your question.
Yes, ma'am. Speaking of reproductive justice, for the college students, if you have daughters, mothers, speak with your daughters, because when I was in college, I thought I had an appendix. I had to drive all the way from University of Georgia, and they removed my ovary. They misdiagnosed black women. They said, oh, you got pelvic inflammatory disease. We got to take, it ended up being endometriosis.
Yes.
It was a small cyst. They took the whole ovary. And as much as I wanted children, and this happens to black women,
All the
we get
time.
misdiagnosed with pelvic inflammatory disease and stuff like that,
Yes.
when they could have saved my ovary and I could have been a beautiful grandmother right now. But anyway, how do we get in contact with you for training for the class? Yeah.
Yes, we do have training not only for midwifery, but we have perinatal training for health workers, doulas, childbirth educators, lactation, and community health workers. My website is commonsensechildbirth.org. commonsensechildbirth.org, and all the information is there. And I'm so sorry to hear your story. I have a similar story. I got here in 1989 with full-blown endometriosis. I was 30 years old, and I'd had it my whole adult life. And I went to start seeing GYN here in Orlando. A year later, after 4 surgeries, they said, oh, we can help you. We're just going to take your ovaries. 30 years old. I woke up without my uterus and my ovaries gone, both. 30. And I'm a medical professional, and I thought I knew something. Doesn't matter. This is about the acknowledgement of what's going on in plain sight and what has been going on for decades. This is not new, and this is not different. And as hard as it is, that's why I'm saying ask, birth, care. Ask the questions, speak to each other, listen to each other's stories, understand the power of these stories, because this is what we have. We have our stories. They cannot be denied. Figure out where is the safest place for somebody to birth. Do that work for your loved ones, if nobody else. Do that work, and then find out who's caring for them, and do they actually care? Because you do, and you will, and we will break this, even if it takes another generation or two. We are not going to stop now.
Right.
I don't have a question, but I would just like to just say a few things. Thank you, thank you, thank you. I have 3 adult children, and all of them was birthed by a midwife. I didn't want the regular doctor. I had 2 at Grady and 1 at Emory, but my daughter, she had 1 at Emory, but she went through a whole lots of things. It's hard to find a midwife, but I think it's the best thing if pregnant women would really look into it. That's where you get your special care from.
Yeah.
Like they said, speak the truth and shame the devil. Because everything that you are saying, I know it's happening. And these doulas, all this special care you can't get that with a regular doctor.
Right.
So like she said, look around, seek out. Sometimes you might have to go to Gainesville or somewhere where one is at because you can't find midwives today. But that's your best option if you're having a baby today.
Thank you so much.
Yeah.
We have emotion in the...
We're so happy that you're here. All right, are we good, Deidre? So as you know, as being a part in founding Black Health Matters, that's why we're here, to have the conversations that just don't get oxygen in other communities.
Yeah.
We're here to amplify Jeannie Joseph and what you're doing.
Thank you.
So if there's anything that we can do for you so that we can elevate your voice, so that you can petition and be out there for health justice, you can count on your family at Black Health Matters.
Thank you. Thank you, everybody.
Wonderful.